So we are first, welcome everybody, welcome the participants and welcome audience for this exciting ISPAE ACES quiz for pediatric endocrine trainees and pediatric endocrine postgraduates. Also the DM and DNB endocrinology trainees. We have had a preliminary round and 16 teams participated, of which these 4 bright teams are here in front of us to face the quiz, final quiz challenge today. We wish them all the best. We are just going to, I'm just going to take out 4 chits to label people, the teams as A, B, C, and D. So we have like team from SGPGI, PGI, MER, and IPG, MER, and Jahangir Hospital, Pune. Is that correct? So I'm doing this just to kind of not have any fixed, because my questions are labeled as team A to D. I don't want to be having any specific pattern in my mind so as to label the teams. So that is the reason I'm doing this. In the meanwhile, Divyalakshmi, could you just enumerate a few of the rules with regards to ISPAE quiz today? You're muted, Divyalakshmi.
Let me just open. Yeah. So all of you, please ensure that you all have a good internet connection, and both team members should be simultaneously present, visible. Video should be on always, and unless the question comes to you like direct question, you will unmute and you will answer. Okay, so otherwise all passed on question or like even the rounds that doesn't have a pass on round, you all have to remain muted. Okay, so if, for example, if the question comes to team A, it's a direct question. Team A will answer by unmuting and they will answer. All other teams will remain muted. Suppose if the team A is answering correct, they'll get the full marks, which is 10 points. Okay. And if the team is not answering, it will be in the same, so we are keeping 20 or 30 seconds for the questions.
So we don't have the timer in this, but I am requesting you to have a stopwatch for 20 seconds each
20.
After each question. After the question is started, then 20 seconds each.
Yes, sir.
After the question is like dictated. For some questions, there are sub questions. In case there is a sub question, the marks get divided as 5-5 each. And round 1 is not a pass on round. Round 2 and 3 will be pass on round. Round 4 will not be a pass on round again. Okay. I think the instructions are clear. I would request audience not to put their answers in the chat box. There are some audience questions which will be displayed. For those questions, you can put the answers in the chat box. This is just to be fair to everybody. Does any team have any questions?
So the passed on questions,
Yeah.
How are we supposed to answer them? Do we unmute and answer, or do we send?
I have shared,
passed on questions?
no, I have shared Dr. Lokesh number in the group.
Okay.
Please save his number. In the same 20 seconds frame only, you have to, type the answer and send it to him.
Okay, but so the team to which this gets passed on to, they will be the ones who send it, right?
No.
It's
No.
a direct question. The question is a direct question to team A or team B or team C. It's a direct question. And if they are answering correct, no other teams will get marks. If they are answering correct, that correct team will receive the direct team will receive the full marks.
So if the team to which question is not directed is not able to answer or gives the wrong answer, in that case, all the teams who give correct answer by WhatsApp will get 5 marks each, not just the next team.
Yeah.
Okay, that is why the provision to WhatsApp has been given.
There is no negative marking, na, sir?
No negative marking.
There is no negative marking. Should we keep? There's no negative marking. For the final round will be a rapid fire round. There will be a set of few questions. You will get 2 minutes to answer those questions. I will be reading out those questions. These questions will not be displayed. The answers have to be one-word answers and to the point answers. Only a complete answer can fetch you full marks. Incomplete answer or wrong answer will not fetch you any marks. That is for the rapid fire round. For first 2 rounds, the rotation will be between team A to D, and the next 2 rounds, the rotation will be from D to A. And the rapid fire again will be rotation will be from team A to D. Okay, is that clear? Now we are just taking out who is team A, who is team B, team C, and team D. I am very thankful to Divya Lakshmi and Hari Mangtani, who have taken a lot of efforts to conduct this quiz. They've been really great. Divya Lakshmi is going to keep the time for us. So I hope that she's ready with the stopwatch. And I'm thankful to Lokesh, whose last minute he's assisted to keep the scores. So after every round, Lokesh will probably recount the scores. You yourself can keep the scores in case there is any disparity after each round. We can just clarify at the same time. Final verdict will be Quizmasters. I get that authority. So there would not be much debate. We can have debate later on. Okay, now I'm opening the 4.
So we'll announce marks after each
round.
After each round, we'll announce the marks. Yes.
Yes.
Sorry, sir, we have one doubt. Which are the pass-on rounds and which round will not be pass-on? Can you please tell again?
Round 2 and 3 will be pass-on rounds.
Okay, sir. Okay. Thank you.
Round 4 and 1 and 4 will not be pass-on round. Rapid fire will not be pass-on round.
Okay, sir. Thanks.
Only round 2 and 3 will be pass-on rounds. So I'm opening the first chit. This is team A. Can you please note down both the timekeeper and scorekeeper? Team A will be from Jahangir.
Please note down.
Jahangir Hospital, Pune. Jahangir Hospital, Pune, you are team A. IPG MER Kolkata, you are team B. PGI MER Chandigarh, you are team C. And SGPGI team, your team D. Is that clear? Team A, Pune, team B, Kolkata, team C, Chandigarh, team D, Lucknow. So shall we start? Divya Lakshmi, Lokesh, are you all ready? Dr. Shaila,
Yes.
are you ready?
Yes.
Ayush ready?
Yes, sir. Yes, ma'am.
Okay.
I am going to just check my PowerPoint once so that I don't display answers in the PowerPoint. Okay, I don't think I have answers in the PowerPoint, so I'm going to share my screen. Can you all see my screen? Is the screen visible? Divya Lakshmi, can you confirm?
Yes, sir.
Okay.
Visible.
So as I said that we will be having, I have tried to be fair and I have tried to put questions more or less uniform, but please pardon me in case in case some of the questions are a little different because it was not possible for me to have exactly similar kind of questions always. So first round will be on basic sciences, second will be on clinical science, third will be on diagnostics. There will be 2 sets of questions in the third round. Fourth will be on treatment and fifth will be a rapid fire round. So shall we begin then? Are you all ready? Okay. So first question goes to team A. I hope you can see the picture. And the questions are there: from which embryological structure are the lateral lobes of thyroid gland formed? And what is the name of structure which marks origin of thyroglossal duct? Your time starts now, Divya. You can unmute and speak.
From the lateral lobes of thyroid are formed from the third and fourth pharyngeal pouches, and the origin of thyroglossal duct is foramen cecum.
Okay, so you would get 5 marks for this. None of you get pass on marks for this question.
Yes. Okay.
Next question is to team B. Name the gene which represses male-specific genes, especially SOX9 in developing ovary. Which ovarian cells are embryonic equivalents of Leydig cells? Your time starts now.
So the gene which represses male-specific genes is the RSPO gene, and ovarian cells which are equivalent of Leydig cells are the theca cells of the ovary.
You get 5 marks for this. We move on to the next question. Team C.
Sir, just a second. We are not able to see your screen, sir, actually, question screen.
Is everybody else able to see?
We are able to see it.
You can
Other
make
part.
the icon small.
sir.
You can make the speaker icon small. You can move the speaker icon so that the person who is talking goes towards the lower corner or whatever. Have you been able to do that?
Hide actors. Yes, sir, now it's visible.
It's visible. Shall we go to team C now?
Yes, sir, yes.
From which embryological structure are superior parathyroid gland developed? Which parathyroid glands are more likely to be ectopic?
Sir, from third and fourth pharyngeal pouch, and inferior parathyroid gland are more likely to be ectopic.
You get 5 marks for this.
5 marks.
5 marks for this, no marks for pass on, because even if half a question is answered, no marks for pass on. This is not a pass on round anyways.
5 marks, sir.
Team D. At what age is zona reticularis evident in human adrenal cortex? From what embryonic layer is the adrenal cortex formed? Your time starts now.
Zona reticularis is evident at the time around 6 to 8 years, and the adrenal cortex is formed from the neuroectodermal cell.
You don't get any marks for this since it is not a pass on round. We will not be having any pass on questions. Okay. So the reason why 2 teams were given pass on rounds was that they gave additional answer, which was not correct. Third and fourth, saying both third and fourth pharyngeal pouches was not a correct answer. It is only one of the pharyngeal pouch that thyroid and parathyroid glands are developed from. So we have an audience question here. The audience can type their answers. Name the gene important in development of exocrine as well as endocrine pancreas. Name the condition resulting from heterozygous mutation in this gene. The participants should not answer this question. Do we get any answers, Divya?
Not
You
yet,
can,
sir.
for this question, you can type the answers.
Oh, okay. We have got one answer. Arun George has replied. Yeah, 2 answers. It's in the Q&A, sir. You can see.
Okay. Okay. So I'm not sure where is the Q&A option coming.
Okay. You want me
Yeah.
to say the
No.
answers?
Yeah.
Okay.
So I've got answers: PDX1, PINK, PDF1, MODI5, IPF, And okay, now you should not answer the questions which are asked for the participants. Only the audience questions should be answered here. So the correct answer is PDX1, and the condition that is associated with heterozygous mutation of PDX1 is, any of the participant can tell you this answer. Unmute and tell. MODY4. MODY4 is the correct answer. And homozygous mutations are associated with? What are the homozygous mutations in PDX1 associated with?
Pancreatic agenesis.
Pancreatic agenesis and neonatal diabetes. I mean, it could present a little later also. But that's one of the conditions resulting from homozygous mutations in PDX1. No marks for you though. Okay. Can we have the scorekeeper telling the marks at the end of first round?
Sir, Team Pune, Team Kolkata, and Team Chandigarh each have 5 marks, and Team Lucknow does not have any marks.
Okay. Back up. This is just one round. So now round two. Round 2 is a pass-on round. So be ready with your mobile. Although, I mean, you can WhatsApp the answers to Lokesh, and we have only 20 seconds. I would trust your sincerity in not Googling the answer. Shall we go on? Divyalakshmi, are we ready?
Yes. Yes, sir.
Round 2. I always have that fear of displaying the answers on the on the question paper since the last time. I hope
One thing, sir. Teams who are sending answers to me, pass on answers, so they should write their team also. Like some high ask is not enough. Answer is not enough. Team name should be there. Team B, A, C, D, like. So I will know which team is sending.
Can you put a message? Can you put a first message with the name of your team to Lokesh right now?
Right
so
now.
Yeah.
Just mention
So
as
B,
team
C,
A,
D,
team B, team C, like that. One of
I
you.
received.
Or mention your city. I mean, mention your city.
Yeah. Received. All received. Yeah. Thank you.
Okay.
Now we can go.
So I think we are starting again with Team A. Team A, are you ready?
Yes.
Team A.
Yes, sir.
Okay. This is a 12-year-old girl with advanced bone age. What is the likely diagnosis?
ACAN gene mutation.
The question gets passed on, and you have the same 20 seconds to answer. Divyalakshmi, please tell us.
Yes.
If the time is over.
Still time is there. Time up.
Okay. Lokesh, you can see the answers received, and you can maybe score the answers if at all. The correct answer would get 5 marks. Should we keep 15 seconds for the passed on, or the same 20 seconds they should answer, right?
Yeah,
So
same 20 seconds.
from the time it is displayed.
Yeah.
Team
So
B,
when
are
I
you
say
ready?
time up, that's the time, like, all the answers that is received before that only is considered. That's all.
Team B, your question comes right now. Team B, are you ready?
Yes, sir.
This is a 5.5-year-old boy with tall stature. What's the likely diagnosis?
Beckwith-Wiedemann syndrome.
Right. Bingo. You get 10 marks. Team C, are you ready?
Yes, sir.
Okay. Here comes your question. This is a 1.5-year-old boy referred for evaluation of a calcium disorder. What's the diagnosis?
Williams-Bure syndrome, sir.
Correct diagnosis. Can you tell some finding that you can see in this picture?
Elfian species and
Okay.
very social behavior, like very happy
You can't
child.
see a social behavior in this picture.
Like ever smiling faces, sir, and
Okay.
stellate iris.
Right. And I have shown the eyes picture for a reason. What is the finding in the eyes?
Stellate iris, sir.
Heterochromia of the iris. Heterochromia of the iris. And you can see the puffy eyebrows. Okay, the puffy eyebrows and the philtrum, typical philtrum, little bit depressed nasal bridge, not very like classical here, but this is William-Buren syndrome. And the endocrine disorder would be?
Hypercalcemia, sir.
Congratulations. So you get 10 marks for this. Nobody else gets any marks for this. Team D, are you ready?
Yes.
Now this is your chance to score marks. This is an 11-year-old girl with short stature. What's the diagnosis? Divya, you are keeping the time.
Turner syndrome.
Question gets passed on.
Time up.
Have we received any answers, Lokesh?
Yes, time up. We received 2 answers, but none of you right. So should I score? Yeah. So Team Kolkata has received like they got 1 pass on, 5 marks. They told correct answer, and Team Chandigarh told their correct answer. Team Lucknow did not tell any correct answer or pass on even, and Team Pune too. So now Team Kolkata is leading with 20 marks. Now it's big lead. And all Team Pune and Team Chandigarh had 5 marks, and Team Lucknow didn't open as of now.
Right.
Yeah.
Sir, Team Chandigarh is at 15 marks, sir. They have corrected. They have answered their.
15. Yeah. Correct. Yes. 15.
Okay. So are we enjoying this till now?
Yes, sir.
Okay. So I am enjoying because I'm in a position of importance. Okay. Now we go on to the next round. Next round is also a pass-on round. There are 2 questions here. Sorry, this is the audience question.
So third round is like D2A. D2A.
Yeah, this is the audience question. Audience can type their answers for this question. What's the diagnosis of this family? We give 20 seconds for audience also.
Many have answered correct.
Thankfully, I did not put this in the. Is the answers coming down? Yes. So many people have answered correctly. It is cleidocranial dysplasia. Right. Are we ready for the next round? Are we ready, Team D?
Yes, sir. Yes, sir.
Sorry. So this round has 4 sets of X-rays for one for each team. You would be expected to answer the questions listed in the slide. What abnormality is seen? Name 1 cause. 5 marks each.
It's radiolucency with intraosseous fibrosis. The hypercallus.
Time up.
Pass. Do we get any pass? Have we got any passed on answers? The passing on has to happen at the same time while the team is answering. You'll not get any additional time. So time is up for this. Yeah, we will. You can keep the scores.
Yes.
And then we can. I would request individual teams also to keep the scores so that if there is disparity, we can discuss it then and there itself. We go on to the team C. Team C, are you ready?
Yes, sir.
This is a 6-year-old girl with bone deformity. Please identify the condition and name the endocrine abnormality seen usually. Pass on also is going on at the same time. So don't take extra time for that.
Time up.
Time up. So no answer received from team C this time. Any answers received from pass on? You can just say yes or no, Lokesh.
I received, but I'll tell. Marks,
Okay.
It's not correct.
Okay. Okay. Team B, are you ready?
Yes.
This is an 8-year-old boy with hypercalcemia. What's the abnormality seen? And name one common condition resulting in this finding.
So the abnormality is salt and pepper pot skull, which we are seeing in this condition. And one common condition resulting in this can be a primary hyperparathyroidism.
Any pass on answers?
Time up.
We go on to team A. Team A, are you ready?
Yes, sir.
Lokesh, the time, pass on answers, please also keep the time in mind. If they're answering within the time frame,
Then only I will, Yes.
Team A, this is an 8-month infant with anemia and hepatosplenomegaly. Name the radiological finding and what is the diagnosis?
The diagnosis is osteopetrosis. And the radiological finding is hyperlucency of the bones. Hyperlucency.
Okay, you
Time
get
up.
5 marks for this.
Time up, sir.
So that's the first part of round 3. We now go on to the second part of round 3, again from team D to team A.
Time B.
Are you ready, team D?
Yes, sir.
Sorry, I keep on forgetting the audience. Sorry. This is ultrasound KUB of a child with poor weight gain and height gain. What's the finding and what's the likely diagnosis? Audience question. We've got the correct answer from Sidhu. Sidhu, you've been answering very well. This is medullary nephrocalcinosis and the diagnosis is distal RTA.
Time up, sir.
Yes. So we go on to the next part of the round. We are still on diagnostics. Sorry, Lokesh.
So next round or next part of the round?
Next part of the round. Next part of round 3.
Yes.
So we have 4 sets of thyroid profiles for you, and we need to have. I'm just going to play with the. No, sorry, it's okay. So we have 4 sets of thyroid profile for you, and we go again from team D to team A. So team D, you are ready?
Yeah.
This is thyroid profile of a 17-year-old boy with hypothyroidism and rheumatoid arthritis. He's on 200 micrograms of thyroxine, and his T4 values are these. I hope that you're familiar with the normal values.
Yes.
And TSH value is this. Please give 2 causes for this thyroid profile.
The acute consumption of thyroid before the test is being conducted. That could be one reason. And there is on the altered set point of hypothalamus, even after it being T4 being correct. So the TSH won't get corrected for the long.
Time up.
Okay.
Time up. Time up.
Yeah, that's fine. I'm just wondering how much marks to give for this answer. May I ask the other teams?
Sir, we have already answered in chat books, like to Dr. We have already sent our answer to Dr. Lokesh. Should we speak?
Yeah, I would want a little discussion on this.
Sir, one condition for this, like despite normal total T4 and free T4, like TSH is raised and child is like, he's a case of rheumatoid arthritis. So he's prone for macro TSH due to like IgG antibody.
Could you repeat the answer, please?
Macro TSH, sir. One condition for this raised TSH.
Could you explain macro TSH a little bit more?
Macro TSH is like when IgG antibody binds to the TSH molecule, like they cause false elevation of the TSH in the like.
So it's a false elevation, and you can differentiate by serial dilutions of the sample.
Yes.
So that's excellent answer. I would probably cut 2.5 points from the answer that team D had given, and there is a reason for that. I will tell you.
So, sir, like for this round, we are giving 5 and 5 for each. Like I will or 10 and 10. Go full marks here. I didn't get 2.5 or 5.
See, any question which has 2 points, we will be divided as 5 and 5.
5 and 5, na? Yes.
Yeah.
So then
I am giving 7.5 just because like 2.5 I'm reducing from this. I will tell what is the reason for reducing to 2.5.
Okay. So one thing I want to like, it's a conjecture only. Which team A explained for macro TSH?
Sorry, no. The other teams won't get answers for pass on this one. Because team D has answered, although partially, but they have answered.
Okay.
Team C, your question is this. Team C. Team C.
Yes, sir. Alan Harnan.
Time up, Divya. Divya, are you there?
Time up.
Sorry, I thought you got disconnected or something. Do we have any pass on answers? We move on if there are no pass on answers. Obviously, I mean, I'm now the next question is for team B. Team B, are you ready? Team B, are you ready?
Yes, sir.
Yes.
The 2-year-old boy with short stature. This is the thyroid profile. What's the likely diagnosis, and what additional tests would you like to do?
Likely diagnosis.
Primary
Hypothyroidism, likely congenital. Additional biochemical investigations.
serum thyroglobulin.
Thyroglobulin.
Others can pass. Sorry. Yeah, please go on. Please complete your answer. Sorry.
It's possibly a case of primary
Time up.
hypothyroidism due to thyroid agenesis, and we would like to do another biochemical test is serum thyroglobulin, serum TG.
Time up, sir.
Right. Lokesh, please note down pass on answers if any.
Yes,
Last
sir,
question for team A. Team A, are you ready?
Yes, sir.
This is a healthy full-term male newborn, TFT done on day 40. The TSH, T4 values and free T4 values are there in front of you. What's the likely diagnosis?
The likely diagnosis is normal newborn, and the gold standard method would be CLIA.
Divya, please tell when the time is up.
Time up.
Okay, for this, the pass on would be counted. So we have finished with 3 rounds. Lokesh, can you update us on the scores and teams can cross-check, please? So now this answer was
for
incorrect.
This question.
No.
Team for team A, pass on answers will be counted. For team B, also pass on answers will be counted.
Yes. One
Team
second.
C also pass on answers will be counted. Team D pass on answers will not be counted.
One second. This is team 1. Yes. team C. Usme, sir, I need to talk because some like half teams are there who has given half, like after two, one is correct, one is not. So how we will decide?
No, passed on half correct is not considered. It's like, isn't
Is
it?
it? Is it?
I think we can award 2.5 marks for the correct answer.
Okay. Like diagnosis is central and then it is equilibrium dialysis. Then it's like difficult to decide. First answer is incorrect, the second is correct. So we can give 2.5 or okay. What should we do?
Lokesh, you should be unbiased and you give the marks. I think giving half mark for that for a pass on is not right. That too half of correct.
You tell me what I will do. I am not deciding.
I think don't give any marks. I think you can take the judgment without seeing the name of the institute.
No. This is no. Please don't.
No, that half of it won't be considered. No, Ganesh. They should tell full correctly.
So that's okay. That's okay for all.
Giving half mark it won't be correct.
No, if the pass on out of 2 questions, if somebody has answered 1 question correctly, we could give 2.5 marks. There's no nothing to do with institutes here.
No, I'm just telling him. Being unbiased, go ahead and tell him.
No, don't get unbiased in this, please.
Yeah, that is what I'm telling him.
No, I will abandon the quiz right away.
Otherwise, that question you take it as invalid and go to the next question.
No. The question is not invalid. All the questions are valid. So we'll just.
No, passing on the invalid. Because they should answer fully, no, Ganesh. Half of is not actually correct. Only the first person, whoever is answering, you can give half mark. For the past one, next one, because they get extra time to think and answer also.
Okay, that is not a problem. So for half passed on answer, you don't give marks, Lokesh.
Okay. Correct. So it is either 5 or it is 0. Okay.
Yeah.
Okay, sir. So in this round, only Lucknow team scored 7.5 for main direct question to them, and no other team answered for direct question. But pass on questions, one Chandigarh team, they gave correct answer, and
it means both the answers, both the component of the answers are correct, or the first one.
No. I am taking only both. If are correct, then I am giving 2.5. I have reduced. Like I have made 0 to 2.5.
Yeah,
2.5 to 0. So out of 2 sets, in first set, in which we had that bone-in-bone osteopetrosis, 2 pass-on teams gave full correct answer, and 2 others gave half correct. So we are reducing them. So now total scores I will tell: 15, 25, and 20. 12.5. Team Pune is now at 15 marks. They didn't score in this. 1 pass on. They did, yeah. And Team Kolkata at 25. Team Chandigarh is at 20. And Team Lucknow is at 12.5.
For Team Pune, the primary question was the gold standard method. So for them, we can give 5 marks for this. It was not a pass on for them.
So, but they didn't tell. They told clear, I think.
Clear. Sorry.
Yeah. So they didn't get it.
Sorry.
Yeah.
Sir, we answered 2 pass-on questions rightly, actually.
Which one? You told.
There's no consistency regarding the interpretation or how marks will be allotted. So, because by our count, sir, we should at least be getting 7.5 in this round. But the goalposts are being shifted as we speak after the questions are done. So it seems very inconsistent, sir.
So sir can declare answers. I think that will be.
Yeah, that will be better.
That will be right thing to do.
So what is it that you are trying to allege? I can straight away abandon the quiz. Somebody else can hold it.
We
Who
are
was it
not
that spoke? Sorry.
we just like regarding this 2.55, there was a confusion. That was what I was trying to say.
No, what is it that you're trying to say?
So I think you can declare answers, so there will be no confusion. But
no, we will be declaring all the answers, but what is it being said? I'm not understanding what is being said. Because somebody is accusing bias of institute, somebody is accusing this change of goalpost. So what is this?
Only, sir, regarding the marks breakdown, in the henceforth, will it be like 2.5, 2.5 or 5, like in this round? That was my question, sir.
For passed on rounds.
Passed on rounds.
The next two rounds are not passed on rounds.
Okay.
Next two rounds are not passed on rounds.
Yeah. Okay. Thank you, ma'am.
And so far, whomever has answered both parts of the question correctly on a passed on round will be getting entire 5 marks.
Okay.
Correct answers are not allotted any marks.
Yes. Thank you, ma'am. Thank you.
Okay.
And to clarify for Team Chandigarh, like you had answered one OI5 that was correct, but you didn't tell what it is. So I initially I gave 2.5, then I reduced to 0, and other I gave you two passing marks. So any confusion you can ask straight away.
Last question.
Team Chandigarh.
Sir, we have answered last question of TBG deficiency and equilibrium dialysis also. Is it wrong, sir?
Yeah, I have given you 5 marks for that.
And
yes.
One for that osteopetrosis and bone-in-bone appearance also we have
But then they have
Sorry.
answered the question correctly, so you don't get any pass on marks.
Okay, sir. Okay. Sorry, sir.
They have answered the question correctly, so no pass on marks. For both parts of the round, for if there were 2 questions, if the full question is answered, you get marks, pass on marks. Otherwise, you don't. Is that clear now?
Okay, sir.
Okay. So now we go on to the 4th round. For this, the rotation will be from team A to team B. Team A, are you clear?
Yes.
Sorry. Audience question before the break.
Sir, then like I have one query before this. Team A, like osteopetrosis question, did we give full marks? I think we didn't. Then I will add.
But even if they have answered half, just like the team D, we wouldn't give pass on marks for that.
Okay. So, but I am confused now. Like
no.
Team
for the osteopetrosis answer was correct by the team to which the question was asked.
But it was half correct.
That's okay.
Okay. So team A, okay.
That's okay. Other teams don't get any marks for that.
Okay, sir.
Same we did for team D also.
Yes. So 5 marks. Okay, yeah.
The audience question is this. Please write your answers in the chat box. What is the conversion factor between whole blood units and serum units?
We have got some answers in the Q&A.
Veena is close. Veena has answered 34. So the conversion factor is 2.2. If you want to convert whole blood into serum units, you multiply by 2.2. That will be 37 point something, the answer will be. Shall we go on to the next round? Team A, are you ready?
Yes, sir.
Now, this is a round on some treatment-related issues. Team A, what percentage of patients had treatment failure with metformin monotherapy in today's study? If you are within plus or minus 2% of the correct answer, you will get full marks. Otherwise, you will not get any marks.
30%.
Pass on is not there for this round, so we will not have any pass on this. Team B, are you ready?
Yes, sir. Yes, sir.
What was the percentage reduction in retinopathy in the intensive treatment primary prevention cohort of DCCT study? Again, plus or minus 2% if you are there, we will give you full marks.
So it was 62%.
Okay, we go on to Team C. Team B doesn't get any marks for this. Team C, what is the recommended duration of treatment with eplizumab for high-risk antibody-positive relatives for people with type 1 diabetes?
Sir. 1 year, sir.
Okay, Team C doesn't get any marks for this. Team D, your question is this. What is the maximum dose of liraglutide used in ELLIPSE trial for type 2 diabetes shown to be effective at 52 weeks of the completion of trial? What was the dose? Maximum dose.
0.6 milligram.
mg daily and for 1 year.
Unfortunately, none of the team have answered any answers correctly with respect to the treatment. So nobody gets any marks for this round. This is the audience question.
In the audience question, let the fellows get chance rather than the consultants.
Audience, anybody can answer. We are counting all the
No, I
answers.
know, but let's give chance for the fellows to participate first.
Yeah,
So it
they have
gives
to
them
type
time
the
to
answers.
answer.
So everybody can type.
Fellows.
As of now, we have not received any answers. Okay, time up for this. Divya, have we received any answers? Karthik has answered correctly.
300 mg, 200 mg, less than 25%.
Karthik and SAK have answered correctly. Now we go on to rapid fire. I'm going to stop sharing the screen. The rapid fire would proceed from Team A to Team D. It would have 5 marks per question. So there are like a maximum of 35 marks can be scored in this round. Before we start rapid fire, could we have scores at the end of round 4, Lokesh?
Sir, I will tell. Pune is at 15, the same marks because no team had gained any marks in this round. So Team Pune is at 15, Team Kolkata is at 25, leading, and Team Chandigarh is at 20, and Team Lucknow is at 12.5. And we can clarify. Team Chandigarh was asking. So I have again rechecked their answers according to what you told. So if they have any question, they can ask right away. After that, rapid fire will be and it will be over.
So we can have discussion even at the end of the session. We will be displaying all the answers at the end of the.
Because you have sent answers, so that is in your chat box and my chat box also. They are same, so we can verify.
So the Team D's question, they are not getting any marks. It has been sorted out, right?
Yes, sir.
Yeah.
Yes, ma'am.
Okay. Okay. So now Team Kolkata is leading with 25. After that, Chandigarh is at 20, Pune is at 15, and Lucknow is at 12.5. And this next round is big, so you can score and you can go anywhere. 35 marks.
So let's start with the rapid fire round. We will be starting with team A and going to team D here.
How long is the 7 questions in answer to be answered in?
2 minutes is what we decided. In 2 minutes, whatever question, if you want, you can pass on. You can say pass if you don't know the answer or if you are not sure about the answer. Unless you say pass, I will not move on to the next question.
And if we pass it, can we come back to the question again if there's time?
No. Once you pass on, you pass on.
Answer, we have to unmute and speak, or we have to write our answer and then send?
You have to unmute and speak. The team has to unmute and speak.
Okay, okay. Sir.
Because this is not a pass on round. So Lokesh has been provided with the answer key. So he can kind of cross check if the answers are correct and not correct so that he can score it. Okay.
Yes.
Now I'm going to minimize my screen. And Divya, I think you have to be very good in this. So you have to start when I say start. So team A, your time starts now. Expand the acronym EDIC study.
Epidemiology of diabetes in complications. But what was I?
Name the scientist who provided laboratory space and equipment which facilitated discovery of insulin.
William Banting.
Long-acting GH molecule recently approved for treatment in children.
Somapacitan.
State true or false. Competitive immunoassays offer advantage over immunometric assays as they are faster, more sensitive, and more specific.
False.
The pump algorithm used in Medtronic 780G insulin pump is.
Predictive.
Genetic defect associated with both hyperinsulinism and hypopituitarism.
GLI3.
Most common cause of ectopic ACTH syndrome in children.
Pulmonary.
Lung carcinoma.
Right. So I will just read out the answers for rapid fire just now so that we can Lokesh and others can score. So acronym EDIC is Epidemiology of Diabetes Interventions and Complications. So this was wrongly answered by you. The scientist who provided laboratory space and equipment was John MacLeod. That's why he got, like, he was the recipient and it became a controversy. So this was wrong. Long-acting GH molecule is lonapeg-somatrogon. I think this was answered incorrectly by you again.
Yes, in that I'll speak after you complete. Yes.
The statement regarding a competitive immunoassay was false. You're correct here. The pump algorithm, you said prediction, but it was not the complete answer. The correct algorithm is PID, proportional integrative derivative algorithm with fuzzy logic. So the complete answer is PID with fuzzy logic. Genetic defect associated with hyperinsulinism and hypopituitarism is FOXA2. And the correct answer that you gave was ectopic ACTH pulmonary carcinoid or bronchial carcinoid would also have been accepted as the correct answer. So I think these can be scored correctly.
I think they told carcinoma. I heard.
Carcinoid. They said carcinoid.
Okay. Yeah. So I'm adding 5. And
I heard carcinoid.
For their clarification, somapacitan is like approved for adult long-acting. It is not approved as of now to children. So for children, only approved is that lonapeg-somatrogon.
Okay. So we go on to team B.
Marks.
Marks.
No, we can discuss the marks at the end of it.
Okay.
We go on to team B.
Yes, sir.
Are you ready?
Yes, sir.
Yes, sir.
Your time starts Divya, are you ready? Starts now. Expand the acronym TEDDY study, TEDDY study.
Pass.
Name the scientist who described case who had features similar to Turner syndrome and after whose name the syndrome is also identified in Europe.
Ulrich.
Name the new category of medications under trial for poorly controlled 21-hydroxylase deficiency patients.
Crenacefort, CRH agonists. CRH antagonists.
Say true or false. The hook effect seen with sandwich immunometric assays lead to falsely elevated levels of the analytes.
False.
The gene defective in type 1A vitamin D dependent rickets is
CYP21A1.
Which component of FIAS has been claimed to increase absorption than conventional aspart insulin?
Pass.
Most common tumor seen in Klinefelter syndrome along with its location.
It's extragonadal germ cell tumors in the mediastinum, commonest.
I'll be reading out the answers, and the TEDDY study you passed this answer. It is the environmental determinants of diabetes in the young. The answer Ulrich was correct. The complete answer is Otto Ulrich, but I would accept Ulrich as the correct answer. The new category of medication, you corrected yourself, CRF1 antagonist, corticotropin releasing factor type 1 receptor antagonist, that is crinecerfont and tildacerfont. So your answer was correct here. The statement regarding assay was false, so you're correct there. Gene defective in type 1 vitamin D dependent rickets, you were wrong here. It is CYP27B1. The component of FIAS that is increases the absorption is niacinamide. And the correct answer for Klinefelter syndrome is mediastinal germ cell tumor. So you were right there.
We got 20 here. So we are on 45.
You go on to Team C. Team C, are you ready? You can unmute yourself.
Yes, sir.
Divya, are you ready? Team C, your time starts now. Expand the acronym TODAY study, TODAY. You can hear me, right?
Yes, sir.
Pass, sir.
Name the scientist credited with clinical description of primary hyperparathyroidism as stones, bones, groans, cyclic moans.
Fuller Albright.
Name the new category of anti-cancer medications associated with thyroid dysfunction described in the recent past.
Cisplatin vincristine.
Name the hormone used in screening for 21-hydroxylase deficiency other than 17-hydroxyprogesterone, which has been shown to have excellent specificity.
DOC.
The genetic cause of hyperinsulinism associated with ketotic hypoglycemia.
Glucokinase.
Could you say it loudly, please?
GCK. Glucokinase.
Dasiglucagon is approved for use in children above what age?
6 years.
6 years.
Most common karyotype in ovotesticular DSD is?
46XX.
Right. So you couldn't expand the acronym today. Today is treatment options for type 2 diabetes in adolescent and youth. Fuller Albright was the correct answer. He described the primary hyperparathyroidism clinical description. The new category of anti-cancer medication is immune checkpoint inhibitors. So it is not, I mean, these cisplatin, etc., are very old medications. Immune checkpoint inhibitors are like known to be associated with significant percentage of thyroid dysfunction. The hormone that is used in 21-hydroxylase deficiency screening, which has excellent specificity, is 21-deoxycortisol. So it is not 11. So you are wrong there. The ketotic hypoglycemia glucokinase was the correct answer. Dasiglucagon 6 years is the correct answer. Can you tell what is dasiglucagon?
Sir, it is like we don't have to reconstitute it. It is ready to use aqueous glucagon.
But it's not exactly glucagon. It's an analog of glucagon. Okay. And the most common karyotype in overtesticular DSB is 46XX. And what is the other one? The next common. This is there are no marks for this. This is just for discussion.
Maybe mosaic site.
Huh?
Mosaic patterns.
No, it's not mosaic. What is the difference between mosaicism and chimerism?
Mosaicism is like when all the cell, chimerism is the like two different two cell population in same individual, and mosaic in like few cells are having different set of chromosome and few cells are having like different.
Chimerism, mosaicism arises from a single zygote. Basically, in single zygote there is a further division and some of the cell lines become different. Whereas chimerism is actually could be a fusion of two zygotes. I mean, I'm explaining it in simple terms. So 46XXXY, XXXY kind of chimerism is the second most common abnormality in overtesticular DSB. Team D, are you ready? Divilakshmi, you are ready? Your time starts now. Expand the acronym DAISY study, DAISY study.
Pass.
Name the scientist under whose mentorship Henry Klinefelter described the syndrome named after him.
Pass.
Name the category of drug recently approved for use in achondroplasia.
Bursitide.
What is the half-life of technetium-99 used in thyroid scan?
Technetium 2 hours.
What is the level of beta-hydroxybutyrate consistent with resolution of decay? The serum beta-hydroxybutyrate level consistent with resolution of decay.
Here, 1.5.
Less than 1.5.
The parameter which is most often used for description of the analytical performance of point-of-care glucose monitoring devices.
Repeat.
The parameter which is most often used for description of the analytical performance of point-of-care glucose measuring devices.
Pass.
The type of mandibular tumor seen in primary hyperparathyroidism jaw tumor syndrome.
Brown
tumor.
Okay, so we are done with the questions. We are done with all the answers. I will read out the answers for this. The acronym DAISY study stands for the Diabetes Autoimmunity Study in the Young. The scientist under whose mentorship Klinefelter described the syndrome was Fuller Albright. So Albright, Klinefelter was Albright's student, and because he was the first author on the paper, he got the syndrome named after him. So I think this is something for, some example for teachers. And the category of drug is C-type natriuretic peptide analogs, that is voseritide. Unfortunately, you couldn't pronounce the answer correctly, so I can't give you marks for this. The half-life of technetium is 6 hours. The beta-hydroxybutyrate level consistent with the resolution is less than 1 millimole. The parameter which is used for analytical performance of point-of-care glucose measuring devices mean absolute relative difference or MARD. Both the answers could have been acceptable. And the type of mandibular tumor is actually not a brown tumor, it's a ossifying fibroma. It's a different tumor. It's not the brown tumor of the hyperparathyroidism. So there we are. And may we know the scores, the scorer, master scorer.
Sir, yes. So it's like almost same as it was in last round. Team A is at 25. They had answered only 2 questions correct. Team B did very well. They answered 4 questions correct. So they are at 45, leading scorer. And Team C, they also answered 4 questions. They are at 40. And Team D couldn't answer any correct answer. So they are at 12.5. So Team B is the winner.
So congratulations to the runner-up, Team C and Team B, and also congratulations to the other two teams who are definitely there. You qualified for the final rounds. That's a big deal.
Thank you so much.
There were difficult questions in the MCQs also. So there we are. Congratulations and thank you, Lokesh, and thank you, Divyalakshmi. Now, do you want to go through the answers?
Yes.
All the questions.
Yes.
Okay.
Yes.
I think rapid fire we won't do because rapid fire we already done.
Sir, sorry to disturb. Could you please tell us the scores once again?
Team A is at 25. Team
Okay.
B is at 45. Team C is at 40. And Team D is at 12.5.
Okay. Thank you. Thanks a lot, sir.
So just 1 minute. I'm sharing the screen again. Okay. This is the easier part of it. So the embryological structure from which the lateral lobe of thyroid gland formed is fourth pharyngeal pouch. So saying third and fourth both is not acceptable. It is the fourth pharyngeal pouch, and the name is foramen caecum. That was answered correctly. The gene that is associated with the repression of SOX9 and other male-specific gene is FOXL2, not RSpondin1. And the ovarian cells equivalent of Leydig cells are theca cells. Both cells produce androgens. The embryological structure from which superior parathyroid gland developed is again fourth pharyngeal pouch, not third and fourth. So saying both will not fetch you any answer. The third gives rise to the inferior parathyroid gland, and the fourth gives rise to the superior parathyroid gland. And because inferior parathyroid glands have to travel a longer distance, that's why they are more likely to be ectopic. So the second answer was correct, but the first answer was not correct. The zona reticularis is evident at 2 years of age. It matures at the time of adrenarche, but it is evident at 2 years of age. And the embryonic layer from which the adrenal cortex is formed is intermediate mesoderm. Even if you had said mesoderm, it would have been accepted, but intermediate mesoderm is the correct answer. In terms of clinical signs, this is a 12-year-old girl who has short fourth and fifth metacarpal and advanced bone age. This is a classic feature of pseudo-hypoparathyroidism. So the diagnosis here is pseudo-hypoparathyroidism. This was correctly answered, Beckwith-Wiedemann syndrome. This was answered, William-Buren syndrome. This is a girl who has short stature and fusion of cervical vertebrae. So she has Klippel-Feil sequence. Could anybody tell me what is the difference between a sequence and a syndrome? Could some of the participants tell, unmute and tell, difference between sequence and a syndrome?
So a sequence is when the various manifestations appear at different ages of life, gradually one after the other.
That's not true. In sequence, one abnormality leads to other. So for example, Pierre-Robin sequence, the small mandible causes problems in the obstruction, etc. Similarly, amniotic band sequence, because of the amniotic band, there is limb vaginis. So sequence is where one abnormality leads to the other, whereas syndrome is just a constellation of things happening together more frequently than, statistically significant, in a statistically significant manner. So this is Klippel-Feil sequence. Even if I had said syndrome, we would have given answer. Klippel-Feil is the correct answer. This is cleidocranial dysplasia. This is intraosseous membrane calcification or ossification. And the diagnosis is skeletal fluorosis. So osteogenesis imperfecta is not an acceptable answer for this. So if you have scored for that, please don't.
No, sir. Actually, OI5 is known and one team had answer correctly, but they didn't say first part. So then initially I gave 2.5 by the Chandigarh team. Then Then I reduced it.
This
So
is
I
a
think they were
classic
talking about
radiological appearance of Janssen metaphyseal dysplasia with significant, which have basically activating mutations in the PTH receptor, and therefore they have manifestations similar to hyperparathyroidism. And you can see the severe metaphyseal, almost like moth-eaten kind of appearance. So this is the classic case of Janssen metaphyseal dysplasia, and the endocrine abnormality usually seen is hypercalcemia with a suppressed PTH. This is multiple lytic lesions in the skull, and the common malignancy that leads to this in pediatrics is acute lymphoblastic leukemia. This is a bone-in-bone appearance or osteosclerosis or not lucency. Lucency is something which is like black, basically dark. So, and the diagnosis is osteoporosis. This we have seen, this is medullary nephrocalcinosis. Here, the word that the team didn't use is non-compliance followed by excessive consumption. It cannot be only excessive consumption of thyroxine just before the test. That will cause low TSH. If it is previous non-compliance followed by excessive consumption, then they will have high TSH as well as high T4 because the TSH wouldn't get time to normalize. And the second, the antibodies was shared by the people. I think you did say about hypothalamic set point, which also is acceptable. This is thyroid hormone resistance to thyroid hormone, RTH, which happens because of TR beta. That is the most common. TR beta would have been a complete answer. Just saying TR would not be enough. This is central hypothyroidism. You can see that the T4 is extremely low and the TSH is not appropriately elevated. So low T4 with inappropriately elevated TSH, that is central hypothyroidism. You could see values up to 16, 18 also. In this case, it was actually 18. I have just reduced it to 12 to kind of avoid confusion. But you can see values up to 18 or 20 also in central hypothyroidism. It is inappropriate elevation. For such low T4 in primary hypothyroidism, you would expect TSH to be very high. So the additional test would be either a MRI of pituitary or growth hormone testing. Both could have been an acceptable answer. Team B, are you there?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
This is TBG deficiency. You have low T4 and normal free T4. This is TBG deficiency. The gold standard is equilibrium dialysis method. The gold standard for free T4 estimation, because immunoassays sometimes in this condition can give you a little low free T4. So immunoassays can be inaccurate. The gold standard is FT4, free T4 by direct dialysis or equilibrium dialysis method. Well, this I think was, I mean, I was expecting at least close answers, if not correct. I mean, the metformin failure rate monotherapy was 51%. So half of the patients did not respond to metformin. Even if you had said half or 50%, it would have been an acceptable answer. The primary prevention cohort, which means those who did not have retinopathy, there was a 76% reduction in the incidence of retinopathy in DCCT. The duration of treatment of teplizumab is 14 days. It is given for 14 days. And it is the 1 year thing is, the results have shown that it can delay the onset of diabetes by about 1 year in high-risk individuals. The maximum dose of liraglutide used in ELLIPSE trial was 1.8 milligram. They started with 0.3 or 0.6. They titrated it to 1.8 milligram. So 1.8 milligram is the maximum dose that is used. And the recommended cholesterol intake is less than 200 mg per day in child 2 diet. Child 1, it is 300. So these were the answers. Again, congratulations to the participants and winners. And sincere thanks to Divya Lakshmi and Lokesh for doing a perfect job of timekeeping. And Divya Lakshmi had to kind of postpone her program. I'm really thankful to her. So anything that you would like to say?
Congratulations to the winners, Kolkata, and runner-up. Runner-up is PJ.
Chandigarh.
PJ, yeah.
Chandigarh.
Yeah. So I think I now request Shaila ma'am to say like, what would be the
I think
price?
we could we could get to them directly with regards to that. Dr. Shaila, would you like to say something?
Shaila ma'am? There it is. Sir, would you like to? You
Hi,
can.
hi, sorry.
Yes.
Well done. Everything went on well. I was a little bit busy in between watching this and my clinic. For a change, it's very busy today. Good.
So thank you. Happy New Year to everybody. And I hope it was enjoyable experience for all of you and some learning did happen today.
Thank you, sir.
Yes,
Happy
thank
Happy New
you.
Year to the whole team and Shala Madam and US also, sir.
Thank you very much. All the best for everything for you all and Happy New Year.
Thank you.
Thank
ma'am.
you. Thank you, ma'am.
See you all,
Bye.
meet you all somewhere.
Yes, ma'am.
Yes.
Bye.
You're
Thank
logging
you.
out.